Good afternoon, everyone. Hope everyone's doing well today. My name is Adrienne Standiford. I'm the Director of Operations here with Alternative Solutions. Today, we've got Spencer Gibson, who is one of our senior Salesforce business analysts, who will be presenting today on Work.com. Spencer put together on this. I hope you all enjoy it. So I'm going to go ahead and pass it on to you.
Thanks, Adrienne, and thank you everybody for joining. If you're watching on recording, we appreciate you there as well. As Adrienne said, I'm an analyst here at Alternative Solutions, and today I'm going to talk to you a little bit about HealthCloud, Work.com, and just kind of the process of reopening your business and trying to make it thrive in a crisis like COVID-19, especially around how IT and Salesforce might help there. One thing that we're going to notice with Work.com, I don't always put this forward-looking statement, but there's a lot, we might be talking about things that are yet to be released on that platform. An example would be volunteer management and the grant management system. That's not actually released and a feature yet, even though it's planned on the roadmap. But we don't want to make business decisions as if it were already released, because timelines can change. I think we've all seen quite a bit that timelines can change in a hurry. COVID-19 did that to a lot of us, I think. So what we'll go over today, we're going to talk a little bit about contact tracing, and more than the specific process of what a contact tracer does, we're going to bring in what a lot of other features within Work.com and HealthCloud and how they relate to contact tracing. So to do that, we'll have to kind of lay out a framework of what HealthCloud is. Work.com is actually a suite of features that have been added to HealthCloud, and we'll take a look at what those are and how they help us manage a crisis. And then we'll tie the rest of Salesforce into this. Salesforce is a pretty robust and large product, and so we'll see how the other clouds play into everything. So as we talk about HealthCloud, we see this is what HealthCloud looks like. And HealthCloud's not so much built as a tool or a set of tools, as it's built around to help complement you as you go through the process of dealing with a crisis like COVID-19. One of the first things we're going to have to do there is stabilize. A lot of us have been through this, although probably are still going through it in certain ways. Stabilizing could mean salary adjustments. It could mean change in inventory management. It could be just accounting for what business partners you're unable to do business with, and figuring out kind of where you're at and making sure that you're not losing the business during that time. We then want to make sure we reopen, and reopening is not necessarily going to look the exact same, but we have to utilize our IT tools to reopen in a way that helps us really connect with our customers and do business in the way that they currently feel comfortable. And ultimately, we want to differentiate ourselves from the competition during a time like this and try and grow our business. And IT can help us do that for sure. One of the first things I look at when I'm trying to understand a new platform or a new area of the IT world is to find some use cases that are really good. Czechoslovakia stood out to me, and I want to take you through kind of just an overview of how Prague, the capital of Czech, handled the virus and what we can learn from them. So this is looking at hospitalizations in Czechoslovakia. And the dates are going to be a little bit weird. They're European, so we're starting on March 10th there and ending just a couple weeks back. And so we see that they first got a spike in cases. It spiked pretty heavily, but they never actually got above that spike again. So when we talk about flattening the curve, I think this is a very good example of what we're looking to do as we try not to overwhelm our hospitals so they can keep our folks healthy. So first they had to stabilize or fight their fires. And they started early at this. They were testing on January 28th. There were no confirmed cases in the country, but they were trying to be ahead of the curve. By February 28th, they tested 170 people, and there were 307 on voluntary home quarantine. So they'd come into the country and been asked to quarantine for 2 weeks, and they all were all doing so. March 1st, they finally got their first confirmed patient. By March 15th, they were on a nationwide quarantine, and they were actually the first country in the EU to require masks on March 18th. And that was actually just because they had finally gotten enough PPE into the country where it was reasonable to require that. Um, so let's look at how IT kind of weighs into all of this. And so this is a graph. The blue line's going to be people that are infected with the virus. And the red line is going to help us understand how much testing they've been doing. And so on March 7th, just a few days after their first confirmed case, they have now started contact tracing. And mind you, January 28th was really when they started thinking about this. So if you've ever built major software, especially a software that's going to touch 12, 15 million people, that's a pretty quick time frame to get something built. From there, they start learning some things. So one of the things they learn is that people aren't going to remember everywhere they've been and everyone they've seen. So they start allowing people to opt in to share geolocation data from their mobile phone or credit card. And that can help us determine where they've been. This is completely optional, and it just shares geolocation data. Again, this was a pretty big technological feat to undertake. What we can learn from it is people aren't going to remember everywhere they've been. On March 30th, we see they bring in military logistics help. So they bring in 300 people. These are paramedics. These are students at their military medical university. And these are logistics people and analysts like myself to focus solely on contact tracing. They learned, and we're also going to learn, that it does take some manpower to properly implement contact tracing. By April 19th, we're going through quarantine release measures for some of the first people that that tested positive. And so you have to do a lot of planning. One, to keep everyone feeling safe, but to make sure there's not another outbreak. So as we look at how we reintegrate people who have had the virus into our workforce, we just have to make sure we're doing it responsibly, and we're taking the proper precautions to keep everyone safe. And you know what? They did a pretty good job. By May 17th, extraordinary measures were ended. All extraordinary measures. I mean, people were going to the gym, they were going out to eat, and we don't see a spike in the viruses or in the virus when that happens. And by June 7th, they're allowing gatherings of 500 people. Again, we don't see a gigantic spike in the virus. We do see a slight uptick, and you would expect that if we're having gatherings of 500 people, but life is semi back to normal at this point. So we do see an uptick here. So we know that there was a mine, an underground mine, and a lot of about 150 workers got the virus all at once there. And that's just a high risk area, but we were able to identify that through contact tracing. We were also able to identify a couple of nursing homes at the same time that got infected. Again, that's a high risk area where it's very easy to spread the virus. But because we did good contact tracing, we immediately tested everyone that had been in contact with those people. And really, you can't have a much of a failure rate here. It just takes one or two asymptomatic individuals to rapidly transmit. But they got control of it, and the curve dropped down, and it's actually done better since. And I think this is attributed, one, to good habits of the citizens there, but it's mainly just ironclad contact tracing. So what did we learn there? We have to understand where our people have been. We want to know everyone that was at work that day, because we can't just trust our employee to remember that. We want to use our systems of record to tell us that beyond a shadow of a doubt. We need to make sure we put the proper resources to reopening in general, contact tracing especially, but honestly, the entire process of reopening our business. And we need to plan ahead. We need to have policies in place, and we need to make sure that we've accounted for the different behaviors of our customers, and that our staff, our employees know what to do in the different situations they might run into. So Work.com and HealthCloud. Let's get into the meat and the Salesforce part. And so first, we're going to look to stabilize. As we stabilize, we're going to establish a workplace command center. This is going to be a place that we can go to see employee schedules. It's going to be a place where we can look at data, like through our AppExchange partner Tableau, and see data on the virus from the CDC, the WHO, or our internal operations. This is going to be a place where we can check wellness status and shift status for our employees. And we're also going to integrate our data from other sources here so we have a complete picture of the business. So as we look at building that out, first we got to build a team. And the team that we have to, as we figure out who we're going to put on that team, we got to keep in mind what they'll be doing. So they're going to define and execute our stabilization plan. So they need to have a broad view of the business to know where our stabilization points need to be. And they have to have the reach to actually implement them with their staff. They're going to help us realign our value propositions, change our customer offerings. So as we talked about earlier, when we reopen, business might not look the same. So they're going to, this team's going to help us figure out how business needs to look different for us to be successful. We're going to prioritize goals and shift resources. And that's just as we figure out how we need to change. This team needs to be able to identify what's most important and then actually implement our plan. And we're going to set and communicate our vision across the company. And this is really important as we're managing this crisis, is that we make sure our employees know how we are looking at it, how we vision the business succeeding, and that they can implement that into their daily work lives. We're also going to want to leverage our CRM here. Initially, this is going to be to rebuild employee productivity. You know, a lot of people are using Salesforce and working from home either part of the time or all the time if they can. And we want to use CRM to allow our agents to still do their jobs in whatever way is safe and comfortable for them. We want to use it to rapidly engage our customers and partners. So we want to prioritize key customers and partners, make sure we get communication out to them immediately, and then address our second and third order priority customers as well, and make sure they understand what's happening. We want to pull our wellness, our financial, and our productivity data all together so we can make swift decisions around all of them. And only by seeing them all together and in a complete holistic view are we going to be able to make true good decisions there. We want to use our CRM to collect data. So our customers can input data, our agents can input data, and we can use that data to help make decisions based on, and we can customize what questions we're asking. And then similar to communicating the vision across the company, we want to communicate that same vision to our customers through marketing efforts. And Salesforce has a lot of marketing tools that can help us out with that. So let's look at reopening and how that's going to work. One thing is shift tracking. And so this comes from Field Service Lightning, and it was adapted from that. But this lets us put our employees' shifts in, see if they've worked together. We can actually automate text messages to go out before their shift and say, are you going to be ready for this? And that can be a way that we can, that shift tracking we saw earlier with the utilization and how much staff that we have available can be really useful there. We can use this to do an employee wellness check. So when someone initially contracts the virus, we need a way to collect information there. So we can build a patient intake form, basically, and we can actually customize this and ask different questions, and it can be a multi-page form that triggers off of logic. And that's going to be how our agents initially talk to the customer. We can also have web forms that collect this data, so our employees or customers could go to the website and input their wellness status, and we can use that. We can then leverage email and text messages with chatbots or with links to a web form to upkeep and say, hey, are you feeling better today, worse? To notify them when their required quarantine time is over, and things of that nature. And one of the great things here is that we can automate a lot of this with chatbots, with the email and SMS and the web form. And COVID-19 is going to increase costs and for most people decrease revenue. So these cost savings that we can get from automating are really crucial as we try and manage the crisis responsibly. Uh, and then we'll contact trace. And so we see here Jane Smith is positive. We're currently monitoring 2 people in her household and 1 contact that we know she contacted. And we can build different logic here, but let's say 10 days before she showed symptoms, she saw Deb Turner, and that's part of our business rules to make sure that we're monitoring her too. And we can build this out and use it to notify people with automated notices, as well as request wellness checks from these different people, or ask them to go get a COVID test. And lastly, we're going to try and grow. And so as we grow, we're going to use things like my Trailhead. And this is a learning management system built on Salesforce. A lot of us have probably used Trailhead. With my Trailhead, we can actually build our own modules. So a lot of people are going to want to do sanitization training with their employees. We can set a due date here and trigger escalations to managers if our employee hasn't gone through that training. We're also going to run a reskill agent. So if we have an outbreak in, say, a call center, which is a potentially high-risk environment, you would need to have agents multi-skilled so they can jump into different queues to make sure you're meeting service level requirements. We're going to take advantage of dashboards, reports, and Tableau. I assume most of you, if you've worked with Salesforce, are kind of familiar with general dashboards and reports. Tableau's got a really nice set of features. It's going to connect to the CDC, or a World Health Organization, and pull in different information about COVID. And I actually updated this, pulled it. This was what's live on Tableau's website today. Those numbers don't look quite as pretty as the US's, but we'll get it under control. I have faith. We're also going to be able to see hotspots and where we've seen the virus blow up recently in our country. We're going to be able to also overlay our locations here, so we can try and figure out which locations are in danger of closing, and we can adjust our revenue model there, or potentially even adjust our marketing spending to digital in areas with high outbreaks, and focus more on retail in areas with low outbreaks where they're not shutting down. And we're going to be able to drill down into information on this. And this is, of course, publicly available information, but the proprietary information that you have inside of your company, we're going to be able to leverage Tableau to display that information in a usable way too. And we're going to use the other clouds inside of Salesforce to grow. Commerce Cloud's going to be probably the biggest one for a lot of people. We're going to move our retail shops to online, and we're going to do that for B2B and B2C businesses in great numbers. You know, that if customers aren't going to the store, they're going to buy online. We're going to be able to report off this, and we're going to be able to report in a way that we can't off retail transactions, because when a customer's in your retail store, unless you're doing some Big Brother type stuff, you're going to have a hard time understanding what pages they visited and what their process of navigating your website was, or your retail space was. We can tell you where the customer went on Commerce Cloud and what they looked at, how much time they spent. And we can use artificial intelligence to drive changes to that. So we can, we've historically thought of a website as something that's pretty static. You have a URL and that's what it displays. But with Commerce Cloud, we can actually identify who the customer is, and we can dynamically display content to them based on what we know their journey might look like or what we think their journey might look like. We're going to use Service Cloud quite a bit here. We're going to, of course, use it in the normal ways like running a call center. We're also going to use it for self-service, and Community Cloud can come into that. But we want to allow our customers to interact with us, or our employees, to give us information without it costing a lot of human resources to do so. Service Cloud is going to let us do that through chatbots and the service portal, as well as the field service app. We're going to give an agent console to them, to our users, and that could be the call center, uh, could be for our HR department. There's a lot of different ways that we can leverage that. And then the field service app. So when our users are out and actually working with our customers in the field, they can update information or take schedule things. We're going to use Community Cloud, and that's going to be a lot of our self-service options there. Community Cloud is going to help us connect with our customers, our partners, and even if we have staff that doesn't use Salesforce, a lot of times we'll use Community Cloud to connect with our staff. And this will let them let us know if they got COVID, but it'll also let them see our different policy changes or our vision changes or what we're doing in the community to help. And this is a way that we can connect with them, because that you do lose some connection when you miss the retail experience. We're going to use Marketing Cloud. We're going to use that to build emails with Social Studio. We're also going to build marketing journeys like we see on the left side, where we send an email out to a specific set of customers, and then based on whether they reply or take other actions, we're going to change how we reach out to them and how we talk to them, so that we can kind of dictate what the journey of the customer is. We're going to use that to track activities in ways that we can't with any other system. We want to understand if the customer opened a email, but we also want to understand if they went to our website after. And then once they got to their website, we want to leverage things like Pardot to see where they went in the website and how they interacted with the website. So we can make decisions on that and change how we market to them based on that. And we're also going to use this to connect through social media. I don't remember the exact statistics, but people have spent a ton more time on Facebook, Twitter, Instagram, and the like since the quarantine hit. And so we want to make sure that we're connecting through social media and that we're leveraging AI to even find places where we should be connecting on social media but aren't. And of course, Sales Cloud. It wouldn't be right to talk about Salesforce without Sales Cloud. We're going to use this to determine trends in how our customers are buying, and even how they're starting the buying process and not finishing it. We're going to use this to help us forecast and determine how business is going to do, and if we need to change the way we do business more than we thought. And we're going to use this to manage our sales processes. And I think that's the biggest part. How do you get a lead to become a sale? And Salesforce has a lot of AI there. It has a lot of tools to help keep the customer experience consistent. And we're going to want to leverage Sales Cloud for that in the growth sector. And my favorite thing, or one of my favorite things about being a Salesforce partner, is their focus on service and giving back. And I really believe that service is the rent we pay for being. And during times of crisis, that can be a good way to show our mettle, I guess. One of the biggest ways the American Red Cross really needs blood. They also provide a great number of other services, and PPE donations are great there. Meals on Wheels and local food banks are mostly all struggling. And hopefully Homer Simpson's, I wouldn't be a good consultant if I didn't tell you not to donate to the one run by a Simpson, unless maybe it was Lisa. But your donations mean a lot there. And of course, the last thing or the most important thing you can do is just be respectful of others, social distance, put on a mask when it's appropriate, um, and just take those small steps is the best thing you can do there. And we really at Salesforce and Alternative Solutions really appreciate anything you do to help out during this difficult time. I want to thank everybody for joining us today. Hope you learned a thing or two. Michelle Palarnello and myself will be taking questions after. If you have a question that might be more specific to your business, uh, feel free to reach out to Jeff Bryan. That his email address is up and it'll stay up on the screen. And yeah, so we'll go through the chat and answer any questions you might have around this. So work.com is several different features inside of HealthCloud. And so HealthCloud is the base product, and that's going to come with several of the features. And then there's going to be add-ons on top of that that are going to be like the scheduling is going to be an add-on feature. And so based on what different pieces of this you need, it is priced out individually per piece though. So you're not having to purchase one big thing and figure out what works. You can figure out the pieces that work and just pay for them. Definitely, we can get you a copy of the presentation, Beverly. There's a video that actually goes out after. So we'll make sure we get that sent out to you. So the CDC data, generally how we're going to recommend that is to use Tableau, which is actually a third party. Their reporting features are just really, really robust, and they're already pulling this information in from health authorities. And so that's going to integrate really well. And there are ways to pull it in to Salesforce reports, but we highly recommend Tableau there because you're just going to get a much easier visual representation of what the data means by leveraging Tableau. Yeah, so that's the idea is that there's different pieces of work.com and kind of the model with Salesforce uh, in general is that you pay for what you need. So there's going to be different pieces that you might even pull in outside of Health Cloud that just make sense for your business. And the idea is that you can build the tools that you need, build the system around them, and then you're only paying for the actual parts of it that you need. Another privately sent question. So is this and more of an international product? And I don't think so. I think part of being a good steward, it's not for a 4 or 6 person business necessarily as much, where you're going to have an easier time doing if you know who came in contact with who, or everyone is in contact with everyone. But even medium-sized businesses, as you have different employees coming and going, you want to make sure that you have a good way to track where they've been and who they've interacted with. Now, we do see this being used internationally. I don't know if any governments have transitioned, though I know there were talks around that, that it definitely could be used on a major scale, and you're going to see companies like IBM and major companies there use it. But I think there can be a lot of value for a medium-sized company too. And certainly all of this could be used if you have been aggregating data internationally, Tableau would be a great way to display that in a CRM. And then one thing we didn't touch on, Tableau also is going to have industry specific information around that. So it's not just the US, but you can actually drill down into quite a few different industries and see what they're seeing inside of those industries, and understand what your competition's doing in comparison to you.
And very informative for us. Does anybody else have any other questions that they'd like to get answered before we shut it down? No, we ran over just a little bit today, but we appreciate you all attending and going through this with us. And as Spencer said, if you have any questions and you'd like to ask after the presentation or after this lunch and learn is over with, be sure to check with Jeff Bryan. And Spencer, did you have anything else that you wanted to add?
Nope, not at all.
Okay. Well, I think that's probably a wrap then. Thanks, everyone. I did want to mention that we will be doing another lunch and learn, but I think we're going to skip next week. As we move into the summer, we might be doing every other week going forward. But we're still kind of addressing that right now. So, but we hope that you can attend another one in the future, and we appreciate you all attending today. Thank you. Hope everyone has a great day.